So carpal tunnel syndrome is actually numbness and tingling that people experience in the hand. It's caused by a nerve that's pinched at the level of the wrist, and it goes through a tunnel that we call the carpal tunnel. What happens is over time, as we get older, there's a ligament on the roof of the tunnel that can get thicker, and it starts pushing on the nerve. It gets to the point where the nerve can't send its signals to the muscles in the hand and the fingers in the hand. What ends up happening is people predominantly get numbness and tingling in the thumb, the index finger, and the middle finger. They'll often complain of it being pins and needles, waking up at night, burning sensations. If it goes on untreated, you can actually lose some of the musculature in your hand and your thumb and lose some of the function in your thumb. So the most common reason is life. But I do get a lot of patients that come in and tell me, I've been keyboarding a lot, that I've got carpal tunnel syndrome. Actually, there's been several studies that have been out that have shown that typing does not actually cause carpal tunnel syndrome. But what we do see is repetitive use, people who are in assembly lines constantly assembling things, fine manipulation, repetitive, and also vibratory tools. I will confirm that exam with a nerve test that's called an EMG. And basically what an EMG does is it'll confirm that the patient has carpal tunnel. If it's in that mild to moderate range, oftentimes we can try wrist braces or steroid injections and see if that helps the patient. And if it controls their symptoms enough, we can just watch it. Other times the carpal tunnel can actually be quite severe, and we see that on the EMG, and we actually see evidence of the muscle starting to die. If we see that, I usually recommend surgery, because if the muscle starts to die, we know it doesn't come back. The surgery is the only thing that's considered curative. It takes about 10 days for the skin to heal and about 6 to 8 weeks really to get your full grip strength back. I usually put the patient in a bulky dressing, but I let them go ahead and start using their hand day one. They can type, they can drive, they can kind of use your hand to feed themselves, do their daily activities. The first time you do a carpal tunnel surgery, success rates are in the 90th to 95th percentile.